Hello again, dear participant, and welcome. My name is Eren, and on behalf of Korean-Catch, I'm very pleased to host and moderate today's webinar. At Korean-Catch, we focus on AI-powered radiological analysis and education solutions in dentistry. So it's a real pleasure for us to bring together today's topic and today's distinguished speakers. Our webinar is titled AI-Powered Radiological Diagnostic in Dentistry from Panoramic Imaging to CBCT and Beyond. We are honored to welcome Professor Dr. Kaan Orhan, Dean and Professor of Dentomaxillofacial Radiology at Ankara University, and one of the world's leading experts in dental and maxillofacial imaging. Professor Dr. Orhan has made outstanding contributions to maxillofacial radiology, imaging technologies, and AI-driven innovation with over 500 international publications and extensive leadership roles in global radiology organizations. Today, we will share his clinical experience. He will share his clinical experience, academic perspective, and insight into how AI is reshaping radiological diagnostic from panoramic imaging to advanced CBCT application. Without further ado, Professor Dr. Kaan Orhan, thank you very much for joining us today. The floor is yours.
Thank you very much again. Thank you very much for having me today. So pretty much today I would like to cover the topic artificial intelligence, which powered with radiological diagnosis. Pretty much we will start from 2D imaging modalities all the way 3D CBCT, and we're just gonna focus on what is going to be happening beyond for the AI and dentomaxillofacial radiology. I hope, by the way, you can see my screen.
Yes, it's clear, doctor. So.
All right. I'm just gonna jump to my pretty much PowerPoint presentation. I will share again. I'm sorry for this inconvenience situation, but let's see. I guess, yes. Perhaps you can't see me. Yes. So what to expect from this lecture? So we will be just covering evidence-based applications in dentistry, radiology, and also we're just going to focus about the prediction studies so far that we are doing in cranio-cage and also in the artificial intelligence work. And we will be just only touch about the blockchain, and I would like to also cover dental MRI and AI applications, which is a growing demand nowadays. And also we will see about the future applications so far. So as all of you know that the progress of AI started in 1950s. Actually, you can find the elements of the AI back in BC 800 from the Greek mythology. Pretty much this is not the topic of our current lecture, but I would like to mention that all these elements can be found even before Christ. But the growing demand started in 1950s with the development of knowledge and the application areas. In 1980s, we started with the image processing and the detection. And also from 2010, we started to learn from raw images and also the use of neural networks for the image segmentation and further beyond for the detection studies. For the better understanding, I would like to make a distinction about the machine learning and the deep learning methodologies, actually. So if you consider artificial intelligence is an umbrella, so beneath this, the term, you can find the machine learning and also under this deep learning. Just roughly, I'm not going to touch all the technical details about the AI, especially for the machine and the deep learning, but what I would like to mention about, especially nowadays, we are heavily use the machine learning and the radio mix modalities, which refers to the study of the computer systems to learn and adapt automatically from experiences. Where the deep learning is a machine learning techniques that layers algorithms and computing units. So having said that, I would like to mention, because when I'm lecturing, many people are just asking me about this. What is the difference between machine learning and deep learning methodologies? So pretty much, as a summary, what I can mention about the machine learning and the deep learning methodologies, starting from the definition, which the machine learning involves the training algorithm to recognize patterns and make decisions based on the input data. But the deep learning utilizes multi-layered neural networks to model complex patterns in data. There are several algorithms, the classifiers that we are using in the machine learning, such as support vector, machine cluster analysis, random forest. But in deep learning, we are much more using convolutional neural networks, especially for the DMFR imaging, recurrent neural networks, fully connected, and GAN networks. The feature processing in the machine learning are much more manual feature extraction, but in the deep learning, the features are automatically extracted. So pretty much you can see the differences between machine learning and the deep learning methodologies in terms of different use. But how these machines can learn? So it's based on the creation of the algorithms that can learn from the raw data. So if you would like to teach a machine, first we need to put the data in it. And the first step of the machine learning is based on the preparation of this data. So pretty much the primary steps of machine learning is to constitute a training data set. Normally, it's like 80% whatever you are just doing in terms of like, it can be image processing, it can be different kind of like image selection and so on. And the validation data set should be 10% out of it, and the final data set is 10% out of it. So in total, you need to divide your data set for machine learning. And generally speaking, machine learning is about how to solve specific tasks based on case studies. So now we are talking about the medical images, especially for the Dentomaxillofacial Radiology. So we have medical images, the DICOM images mostly, but not necessarily DICOM images. You can also use different kind of BMP, different kind of like JPEG images or TIFF images and so on. But out of these images, you can extract the features, and you can train, and finally you can classify for the output. So this is pretty much simple how the machine is learning. Of course, the classification and the feature extraction is the most important part for the machine learning. So out there are many classification regression algorithms, as I mentioned, just like naive Bayes, decision tree, like logistic regression, random forest, and so on. So you can test all these kind of classifiers for your machine learning. So out of it, you can pick up the best machine learning, best classifier for your purposes. Of course, there are different types of machine learning. So one of the most popular is, back in those days, we were using supervised learning, where you have input the data and output variables, and you use an algorithm to learn the mapping function. And then we started to use the unsupervised learning, where only you can have the input data, but no output at all. So we will ask the machine learn without any supervision. The term semi-supervised learning is constituted after supervised and unsupervised, where you have a large of input data, but some of the data is labeled, so you are expecting the machine learn out of this data. And finally, nowadays, we are using heavily the reinforcement learning, where there is not needing any label input or data, so we are forcing the machine to learn by itself. So this is a very simple fundamentals of the machine learning, but how about the deep learning? When we are talking about the deep learning, of course, we need to identify the artificial neural networks, which are mathematical models inspired by our biological neural networks. These neural networks are able to model and process nonlinear relationship between the input and outputs. So if you ask me as a radiologist, if you give me a panoramic image or whatever 2D or 3D image and ask me to extract a feature out of these images, I can just like classify maximum 10 of them, such as this is radiolucent, this is radio opacity, or if there is a lesion, the lesion is expanded, it is going beyond corticated, and so on and so on. But I can define like maximum 10. But when we are using the ANN, especially the deep learning, we can extract also the features in the hidden layers. So we have an input layer and also output layer, but together with these input and output layers, there are like hidden layers that are interaction between all these input and output nodes. But how the deep learning is working? Frankly, and also simply, the deep learning is the combining of all these artificial neural network layers, and then together with the mathematical operations, we can solve the certain tasks. Most of the time, solving these types of neural networks is contained we call it black box. Even nowadays, we don't understand fully how these deep learning artificial neural networks are solving these terms of tasks. But now we started the explainable AI models. So step by step, we understand how these deep learning, especially the hidden layers, interact with itself. So the term, the deep, refers to the number of the hidden network layers used to gradually extract the information. So there are different types of algorithms nowadays. We are using like artificial neural networks, convolutional neural networks, and the GAN neural networks, and so on and so on. But we are using, especially for the Dentomaxillofacial Radiology, convolutional neural networks. So convolutional neural network is a class of deep neural networks to apply to analyze any visual images. So from simple pattern on an image, we just identify first the pattern and the edges, and from edges it will combine all together in order to constitute and make a classification out of this feature learning algorithm. So the first thing, the convolutional neural networks is working on the edges, and then it turns to be textures, from texture to patterns. Then we will start to identify the object parts, and finally we can make the segmentation of the objects. As I mentioned, I'm not going to touch too many technical parameters here, but the ANN and the CNNs are out there almost 20 years, more than 20 years. So it started with the LeNet, AlexNet, and also it grew gradually right now. One of the most, especially CNN network that we are using nowadays is the UNet, different types of UNet and 3D UNet CNN architecture algorithms to make the segmentation of the both anatomical and the pathological features. Here's a description, or here's a classification, almost 10 years, that is covered by 10 years. And right now we are using heavily these types of convolutional network for our purposes. So how these deep learning methodologies be used in image. So in the image analysis, first we can make the segmentation, and now from the segmentation we can make the object detection, and also we can classify. And one step forward of this, we can also make prediction out of our data. When you're reading a paper, or when you would like to evaluate the success of these convolutional neural networks or machine learning algorithms, we need to understand different kind of terms, because you will get used to these types of terms while you are evaluating your artificial intelligence, the success of your artificial intelligence models. One of them is like pretty straightforward, coming like standard statistics is the confusion matrix and the ROC curves, which we are evaluating like precision, recall, F1, accuracy, and specificity as well. There are also different types of like statistical networks, which we can also evaluate for this purpose. One of them is Matthews correlation coefficient, can be used as a measure of quantity of two class classifications. The dye score, as known as the dye similarity coefficient, is a measure of similarity between two sets of data, and also intersection over union can also be used to evaluate these success rates. Having said that, I would like to also briefly mention about the radiomics. As I mentioned earlier, that if you give me an image as a radiologist, I can extract like maximum 10 different kind of features out of this image. But images are more than pictures, they are data. So pretty much together with the radiomics and also together with the clinics of the patient, we can make algorithms for the machine learning methodologies in order to make segmentation, in order to make object detection, and in order to make prediction of the diseases. So how it's working with this radiomics? So you have an image, either you have like 2D or 3D image, you have a volume of interest for delineation, and now from this volume of interest you can classify, make a clustering, and then you can play around with the contrast, correlation, energy, entropy, and homogeneity. And from this, you can extract the feature. And finally, you can make an algorithm using the machine learning methodologies. So using the radiomics software, we can extract more than even 10,000 different radiomics features describing the tumor shape, tumor intensity, tumor extraction, or the anatomical, whatever you are looking for, like anatomical landmark, shape, intensity, texture. So basically, we are using these types of features to extract whatever we are looking for. So let me give you two examples for this. One of the examples that we constituted with it last year. So we were evaluating the temporomandibular joint disc displacement out of the MRI-based radiomics analysis. As you can see, we made an algorithm using the machine learning and the radiomics, extracting the radiomics features together with the clinics. From the image, you can see it is quite nicely make the segmentation of the TMG structures for this time TMG disc. And we can also not just make the segmentation, but we can detect the object. In this case, this is the temporomandibular joint disc, and we can make a classification whether it's an anterior disc displacement or whether it's with reduction or without reduction cases. Another example, as all of you know, that the diagnosis of the ameloblastoma and odontogenic keratosis is quite challenging, even with the pathology. But nowadays, we are applying radiomics together with the machine learning methodologies, and it is quite high to make a distinguish from the CBCT images. As you can see, it's over 0.8 for this distraction purposes. So nowadays, even though we cannot make a distinction out of the image, but we have a decision support system using these radiomics-based machine learning algorithms. So what we are using artificial intelligence in 2D dentomaxillofacial radiology. So we are doing almost these types of studies in cranial cage like more than 7-8 years. We started with the tooth numbering in the first hand, because as a dentist, when a new patient arrives to you, so the first thing that you are just doing is to make the tooth, what is there, what is not there. So you are counting the tooth, what is missing, what is not missing, then which we started all the way from there. So pretty much together in 2D imaging modalities, not just on the periapical or the bite-wing radiographies, but the panoramic radiographies, nowadays we can do the tooth numbering. And also we can make the segmentation on the 2D images quite nicely. Let me show you different kind of like examples for this purpose. As I mentioned, we were just like started with the tooth detection and numbering on parametric radiographs, and we achieved quite nice scores, especially 0.98 for the tooth numbering. When we're just checking the literature, nowadays the tooth numbering, not just only for the deciduous teeth, but for the permanent teeth, it's over 95% correctly diagnosed with different kind of algorithms. Not just only 2D modalities, but we have 3D CBCT volumes as well. And out of these 3D CBCT volumes, we can just also extract the tooth numbering out of these volumes as well. And also we can show the dental morphology from 2D and 3D images. In a recent study, like we did like 2 years ago using with cranial catch, so we were making the description of the anatomical landmarks on panoramic radiographs, especially in the pediatric population. As I already mentioned, that it's not just only the primary, primary teeth, but also we are just like doing for the mixed dentition to detect the anatomical landmarks and the tooth numbering as well, which is quite challenging though, because at the mixed dentition, the machine needs to understand and needs to know what is really the deciduous teeth and what is really the anatomical landmarks. But as you can see from the study, we achieved quite nicely F1 score and the precision and the sensitivity for the anatomical landmarks as well. Nowadays, for the cranial catch, for the panoramic radiography, we can detect almost like over 30% of different conditions, such as like dental problems, dental restoration, dental implants, anatomical landmarks, and periodontal conditions, and so on. And the F1 score is reached the highest 0.95 to 1, which one is the top score. So pretty much nowadays, we can make the segmentation out of the 2D images, and also we can detect more than 30 different kind of condition in 2D modalities as well. Here's another case for the mixed dentition. See, we can check it out the tooth numbering for the mixed condition, and we can also show different kind of anatomical landmarks, the mandibular canal, and also, as all of you know, that we have superimposition of the airway. We can also extract the airway, the orbital and the maxillary sinus together with algorithms. So the caries detection is also the second issue that we are by our daily clinical studies. As all of you know, the dental caries remains a significant oral health burden globally. So pretty much, so according to the World Health Organization, it's like over 2.3 billion people are suffering from the caries detection, especially in our country. So this is one of the most prominent symptoms that is taking all the patients to the dentist. So pretty much we need to identify the caries lesion. So the best option for the caries lesion to detect is the bite-wing radiography. So pretty much the bite-wing radiography is the gold standard nowadays. But the bite-wing analysis is sometimes quite challenging as well, because if the caries lesion in the animal side, even though if you are probing, if you are doing an intraoral examination and so on, you cannot identify. Sometimes you cannot identify from the radiograph and from the clinical probing as well. So we generated different kind of algorithms using with the deep learning approach for the detection and segmentation of dental bite wings. For this study, we both make the segmentation of the caries lesion, and also we classify the caries lesion, which you can see the sensitivity and the precision and the F1 score is quite high. As the algorithms like keeps continue be feeding from different kind of bite wings, from different kind of cases, so it is grow and grow, and these types of score will be like close to 1 anyways. So another challenging part is the periodontal bone defects. So the detection of the periodontal bone loss patterns is sometimes quite challenging into the radiographies, especially bifurcation defects as well. As all of you know that the horizontal bone loss mostly related with the diabetic patients, and also the vertical bone loss is straightforward. But the bifurcation defects is always challenging into the imaging modalities especially. So we perform a study about this, and you can see from this study it's quite high to detect the periodontal bone defects. One thing is important, not just only for the dentist, but also for the patients as well. Because when you are telling the patients, you have this and that, you have caries lesion, you have periapical lesion, or you have like alveolar bone lesion and so on, the patients, most of the time, they don't understand anything. But when you do have a segmentation, and this means that, and also when you have like colorful, like colored representation of the diseases, then your patients start to understand what is it. So we also perform different kind of studies in terms of the caries detection and the periodontal bone loss detection. Another challenging part, as all of you know, that the CBCT is prone to artifacts. So there are quite different types of artifacts that can be generated by the CBCT volume, especially for the secondary caries lesion under these restorations. So pretty much we can just erase the artifacts together using the AI algorithms, and we can make a segmentation of the caries lesion, which is quite high ratio. Let me show you two examples for this. For this case, in the first slide, you can see there is this caries lesion that is picked up by the AI algorithm quite nicely, and it was just like a sign of caries lesion. But here it is signed as caries lesion, but this is misdiagnosis case due to artifacts. So pretty much still we have some time go to CBCT caries detection. So the periodontal bone defects, as I mentioned, nowadays we are working on to understand the AI decision support systems from 2D and 3D imaging modalities. And moreover, we are working on how we can visualize 3D, 3-wall periodontal defects out of 2D images. Because using the radiomix modalities, we can extract, remember, even more than 10,000 different kind of features from 2D images, and also if you are using 3D images. So now we are starting to identify how we can pick up for these features to understand the bone defects out of the images. It's not just only the radiography, but also we are using for the detection of the tooth numbering and the frenulum attachment from the intraoral photos as well. For this paper, we were just extracting from the intraoral photos to make the segmentation of the tooth numbering automatically. And also we can just identify the gingival inflammation and gingival overgrowth. Again, it's just not just only for the professions, dental professions, but also for the patients as well. So if you're just going to define these types of like pathologies and also show these types of pathologies to your patient, they will definitely understand what is going on. The dental pathologies and the dental restorations are one of the key working area for the AI. So the first thing that we have done for the apical lesion segmentation on panoramic radiographs from the 2D images. And as you can see from this study, we achieved more than 0.92 for the sensitivity and close to 0.9 for the F1 score and the precision. So we can make the segmentation of these types of apical lesion and also we can show to our patient for better understanding. Not just on the 2D, but we can do these periodical segmentations on the 3D images as well. Recently, we also developed a YOLO-based deep learning model for the detecting and the segmenting of the dental restorations. This study is quite important and also is quite interesting. As you can see, the segmentation of the dental restorations is quite straightforward. So pretty much either you are using the supervised or unsupervised or reinforcement learning. It can pick up the dental restorations all the way. But in this study, what we did, we can also pick up not just only the dental filling, but also we can visualize the model can automatically make a segmentation of the dental pulpotomy, and also dental pulpotomy material segmentation can be done very nicely. So pretty much this is quite important because the segmentations of these types of dental restorations and also for these types of pathologies is quite challenging because it may be super overlapped and the algorithm cannot identify what is there, what is not there. But pretty much we made all this segmentation out of this model. So what we can do together with the cranial cage, we can make the tooth numbering, we can identify the dental pulp, make the segmentation, and also we can identify the caries lesion, the anatomical alignment, residual teeth, and all the filling as well. And one good thing is that just one click away from this one click, you can generate a report and it's all the way. You can even put your signature for the reporting straight ahead. Of course, there are huge pathologies nowadays we are dealing. As I already mentioned, it can be like odontogenic keratosis or different kind of cystic lesions of ameloblastoma. Now the algorithms can detect and make the segmentation of these pathologies and gives the dental profession for the better understanding and for the decision support systems. Here is examples for this case, like this is squamous cell carcinoma, metastasis to the bone, and this one is ameloblastoma case, different kind of ameloblastoma case, radicular cyst, and we can identify more than 10 different kind of like cystic and tumoral regions together with this modeling. Another use of like AI, starting from the beginning, is the cephalometric analysis, right? So pretty much there are too many commercial softwares out there, and also there are web-based commercial software. So previously, how we can measure these types of like cephalometric studies is the manual tracings, and later on it was like semi-automatic traces. But right now, we can do it like in 2D and also 3D cephalometric analysis all the way, not just only one analysis, but we can do like different types of like Steiner down analysis and so on. As I mentioned, there are too many software algorithms, even web-based, you can use. I was mentioning about the bite wing analysis, but one of the most important use of the bite wing analysis, the overhanging restorations as well. So, which is quite challenging sometimes because you need to understand if you're just going to like make the retreatment of the these restorations, and you need to understand if there are like caries lesions under these secondary caries lesions under these overhanging restorations. So we perform a study about this. The important part of the study, as you can see from the table, the AI, the cranial cage, had the scores very similarly of the experts dentists with 6 years of experience. So as you can see, the AI algorithm reach out the experienced dentists, like with 6 years experienced dentists all the way to detect these types of overhanging restorations, and it's gonna be better and better. Not just on these dental restorations, but we can detect of the pulp stones as well, which sometimes can be problematic for the root canal treatment as well. So we achieved almost 0.9 to detect the pulp stone and also the analysis as well. So pretty much for the bite wing analysis, we can make the segmentation of the pulp. The periodontal bone loss can be measured automatically without doing anything, and all these restoration, overhanging restoration, the caries lesions can be appeared simultaneously to you and to your client, to your patient's understanding. Recently, we also performed different kind of analysis for the periapical as well. This one is about the detection of external root resorption. Again, external root resorption can be challenging because sometimes it can interfere with the internal root resorption. Sometimes it can be overlap because of the superimposition and so on. So we generated a YOLA-based deep learning model for this. And as you can see, the sensitivity is 1. And the algorithm can make the segmentation of the external root resorption perfectly. So for the periapical analysis, again, we have tooth numbering, we have also dental pulp extraction, root canal treatment, and periapical pathologies can be extracted all the way out of these algorithms. So let's jump to artificial intelligence in 3D in dentomaxillofacial radiology so far, what we are using. So there is a term which is called the digital twin. So in the digital twin, we can scan the patient on the CBCT, we can scan with the intraoral scanner, we can do a face scan, and we can make the segment, all the fusion of these modalities to create a digital twin. Once you have this digital twin, you can play around with everything in terms of like restoration, in terms of surgery and so on. So pretty much the feature is going to be to create this digital twin, and even before making any kind of treatment, the AI, decision support systems, will help us to design and also to predict the treatment modalities. Let me show you the segmentations of the 3D imaging modalities. As you can see, the segmentation quite nicely segmented all the bone, maxillary sinuses, all the teeth, and also different kind of anatomical landmarks in the first hand. What we can achieve from the axial image, we can achieve from the coronal, and also we can achieve from the sagittal, and also the 3D imaging modalities. See how it's nicely denotated. Especially, please check it out, keep an eye on the third molar. So there is a disturbance on both sides of the mandibular canal, which gives us a quite nicely like aspect while and also before extraction these types of tooth. So you can erase or you can just take it out of the images, you can play around even before making any kind of dental treatment. We performed several studies about these AI generated, especially CBCT based AI generated STL files. For instance, in this study, we performed an evaluation for the osseous changes of the mandibular condyle, especially if you are not very familiar about these types of pathologies. So the AI decision support system can make the segmentation and can make the classification, and especially for the bifid condyle formation, osteophyte, erosion, and flattening, it's almost perfect. We also performed a study for the maxillary sinus segmentation on cone beam CT because, as I mentioned, if you're not familiar with the maxillary sinus pathologies, you can overlook these types of pathologies, especially for the CBCT imaging. We also perform further deep learning model for the automated segmentation of the sphenoid sinus and the middle skull-based structures. Of course, it's not just for the dentists, mostly for the radiologists, but especially if you're dealing with the CBCT imaging, as I mentioned, it may be quite challenging to do so. So the AI can make the segmentation and can make the classification of the anatomical landmarks that playing around, especially. Here is the 3D representation of this study as well. So in 3D modality, we are also working on the periodontal diagnosis, which is a growing demand nowadays. So the artificial intelligence, especially the algorithms, can detect the patterns of the periodontal bone loss in cone-beam CT images. And see, we performed this study in order to understand the total alveolar bone loss, supra-infrabony defects, periodontal lesions, buccal defects, and the furcation defects. And you can see how the scores and the accuracy is quite high for the detection. So in this study, we also performed different kind of dental conditions. Remember that in cranial cage, we can just like evaluate like more than 30 different kind of, over 30 different kind of pathologies, but we can also evaluate these types of pathologies in CBCT images, like the caries, restorative filling materials, root canal, pontic implant, tooth, and so on. So pretty much the scores are quite high to detect these types of pathological lesions. Still, we have to work on the mixed jaw lesions. As you know, the sensitivity is a little bit less, but the cases when you're just going to fit the algorithm, different kind of cases and the lesions, then it will be starting to learn more and more, and this course will become up again high. So what we can do also, we can do automatic implant planning as well. So as all of you know that while you're doing an automatic implant, while you're doing an implant planning, you have to measure the height and the width. So if you're not familiar with the CBCT imaging, sometimes you can overlook, or sometimes you don't understand where you're just going to measure, but the AI is just doing on behalf of you. Not just on the static, but also dynamically. See, this is one of the study that we performed. So in dynamically, we were just like measuring the pathology. What is going to be behind and beyond for these studies, as you can see, this is a dynamic evaluation. So the next step will be producing different kind of like robots or robotic applications in order to put a robotic insertion of the dental implants. But how the data or where the data will be coming from this AI algorithm, dynamic AI algorithms. Previously, we performed a study about this. We measured the height and the length for the implant sites. And in the end, we figure out a quite high range to detect the measurements and also to detect the implant size and to make the measurements out of these CBCT images. One of the most problematic part, especially in dentistry, as all of you know, is the dental implant detection and the classification. As all of you have different kind of patients, so these patients have like dental implant treatments like 25 years ago, like 20 years ago. They don't even know what is the dental implant so far. So pretty much what we are working on, the dental implant detection, 2D and 3D, and also to make a classification out of the images. So this will help dramatically to the dentist to identify the dental implants. One of the major, especially site that can be used for the mandibular canal detection, especially while you are dealing with the impacted tooth, we can trace the anatomy and we can make the classification if the mandibular, let's say the third molar is away from the nerve, if it's just touching the nerve or if it's interactive with the nerve. It is quite important for the dentist before the surgery. And here is the 3D representation of these kind of nerve tracings as well. I would like to show you this case here. This is quite like interesting case. So in this case, there is a 3D representation of the nerve. In the first time when I was just doing this segmentation, I thought that this is somehow like a misdiagnosis of missegmentation, but in the end, it turned out to be a schwannoma case. So pretty much together with this 3D segmentation, it can be very useful to identify even an experienced radiologist overlook on this side as well. So we can use for the 3D representation for the fully automatic segmentation of the DICOM files. And also, as I mentioned, we can use the cephalometric analysis. But in this case, it is not just 2D, but we can use like 3D cephalometric analysis. So out there are too many like vendors, and there are too many companies working on the cephalometric, 3D cephalometric imaging automated. So this is one of our studies. So we were just like making a fusion of the 3D representation of the teeth. Not just only detect the anatomical landmarks, but we can do like angular and the linear measurements of the craniofacial structures as well. What we can do, we can make the 3D ceph, and also we can do like the analysis out of the teeth position as well. Here is one of the 3D representation of a vendor. So what we can do from the 3D image, we can do somehow the 3D representation of the teeth, and we can play around with this tooth as well. The prediction side is quite new, and we are working on this very heavily. So the prediction using the AI algorithm will be a growing demand. For instance, in this study, we predict the extraction difficulty using the deep learning methodology. So we can predict even before making any kind of surgery for the impacted third molars, if it's going to be extracted nicely or if it's going to be extracted difficulty. We can also make the prediction of the orthodontic surgery as well. Nowadays, we are working on this. We are considering a different kind of like algorithms for the prediction of, let's say, Lafort osteotomy or sagittal split osteotomy, even before any kind of surgery. Of course, it's not just only 3D CBCT imaging, but also we can use the ultrasonography-based machine learning methodologies as well for the soft tissue. For this study, we developed, and we validate an ultrasonography-based machine learning methodology to predict the bruxism treatments. So what or which treatment, bruxism treatment, will be beneficial for the patient. So pretty much we have these types of algorithms. So finally, I would like to mention a little bit about the beyond what is waiting for us. So what is waiting for us is the AI in prosthetic planning, especially. So in the future, we will be predicting the treatment outcomes, especially for the smile design and occlusal analysis that can be done. If we have a CBCT volume, so pretty much the CBCT can show you the contact point and occlusal adjustments all the way. So you can check it out, these occlusal points, and you can like understand where it's just going to be reshaped for your prosthetic rehabilitation. We can also make prediction the bonding of the CAD/CAM or composite resin chromes with AI, which is another topic. We also performed several studies, especially with the zirconium implants. As all of you know, that the dental implants, especially the titanium implants, are quite reliable, but the zirconium implants are prone to be fractured. Now we developed an algorithm for predicting the fracture risk for these zirconium implants, and we achieved quite high 0.72 to predict. Out of 100 cases, we can predict like 75 cases for the implant fractures. So pretty much this is also going to be a game changer for a clinician to perform this. We can also do in the beyond for the bone density measurements as well. For the bone density, as all of you know, that in the spatial CBCT imaging, we don't have a standard Hounsfield unit, but we need to have this data because of the bone density classifications. This is the straightforward classification by Mish. But together using with the AI methodologies, now we are pushing forward to identify these types of standard units on CBCT images as well. If we are just going to have a dual source energy or dual energy CPs, dual source via dual energy CBCT, then we straightforward can identify the personalized approach of the radio density. Then it's going to be also a game changer for the CBCT as well, because one of the most problematic part is to detect the peri-implantitis. Now we can very easily overlook these peri-implantitis cases because of the artifacts like exomass effect. But now the AI can make the segmentation and can make a decision support what is peri-implantitis or what is not peri-implantitis. So pretty much in overall in 3D imaging, so what we can do, we can extract the bone, we can extract the teeth, we can extract the gingiva, and also we can do the periodontal bone loss measurements simultaneously and automatically. Last but not least, we can also detect the oral mucosal lesions. So pretty much, as all of you know, that we are dentists, completely we are working on the oral mucosa. So pretty much we generated several algorithms to detect both from the intraoral radiographies and also the pathologists to detect premalin lesions such as oral lichen planus lesion. So this is one of the deep learning algorithm that we generated, and we achieved quite high score to detect these lichen planus cases. The AI algorithm make the segmentation and make the detection and also the classification. We also perform the detection of the oral cancer lesions from intraoral patient images, and also the images can be detected simultaneously and can be classified by the AI algorithm itself as well. So, having said that, I would like to finish my presentation, I guess, right on time. I will be very happy to reply all the questions that will be coming from the audiences. Thank you very much.
Initially, I would like to thank so much Professor Kaan Orhan. It is a great presentation. If it is possible, I would like to ask a question. I'm wondering, you mentioned in your presentation, actually, in the CBCT, we have no Hounsfield unit for the evaluate the bone quality. But I'm wondering, with the using AI algorithm in the near future, can we estimate it to bone quality and the classification for the by the mesh? Can we handle this with the AI using the CBCT? Yeah, dual CBCT technologies also is coming. Maybe it will be help us, but maybe in the we are using the in sensoring data or etc. to estimate to bone quality using AI algorithm. Maybe in the future, I'm thinking now, but really, I'm wondering, what do you think about that?
It's a very nice question, though. As all of you know that in CBCT, because of the technical itself, we don't have an Hounsfield unit. Hounsfield unit is mainly depending on the computed tomography images, medical computed tomography images. So pretty much we have like -1,000 to +1,000 different kind of Hounsfield units that we can just like make a standardization on all CBCT medical all medical CT scanners, but on CBCT we don't have this. But As I mentioned, nowadays we are working on to make the standardization of the mean gray volume that we are taking out of the CBCT images. So pretty much, as I mentioned, we are extracting the features. The most challenging part in this issue, especially, all the CBCT images are not the same. So you have different types of like KVP, you have different type of MA or scanning conditions and so on. But in the end, the images are raw data. You can compute them. And if you have the specifications that is taking the images, so you can use to constitute an algorithm. And even if you have a dual source or dual energy CBCT, it's not routine right now. There are just only three or four companies, 3 or 4 machines out there that is used for the dual energy. But if you have dual energy, you can extract the images using, for instance, like dual source or dual energy. Let's say if you are taking a 70 kVp or 90 kVp, so you gather all this information to make the computation for a standardized units, but not necessarily. Not necessarily. Even if you don't have a dual source CBCT, still you can compute these standard units using the AI algorithms. So in the future, I'm not telling you like 3 or 4 years or something like that. In the upcoming year, this year, we will be, I'm pretty sure that we will be achieving these types of like standardized units from the CBCT images for the personalized bone densities. What is going to be beneficial for us, as all of you know that like by the classical MISH classification, so we have these types of from D1 to D5, right? So we can like plan our surgery, especially dental implant surgery, out of this classification. But as I mentioned, we generated an algorithm. We are working on this to make a standardization, and we are comparing with the gold standard medical CT for this purpose. So we have both CBCT and the CT for the same patient. So pretty much the units that we generated are quite high. And in this year, I guess we will be releasing these types of like standardized units for the CBCT as well. So this is coming actually. It's not like 3 or 4 years later, so it will be coming this year.
Thank you very much.
Okay, right now, do we have any other question? We are waiting for us.
While waiting the questions, I will briefly also mention about the which actually I couldn't touch the dental MRI and AI because of the time limitations, but pretty much now dental MRI is a growing demand in dentomaxillofacial radiology, and especially in our country, we started using heavily about the MRI. So in our facility, we have 2 different MRIs, especially we are using routinely for the dental MRIs, and also we perform several different kind of like models for the tooth segmentation and also for the anatomical segmentation out of the dental MRI. I can also definitely tell you that we can also generate a regular CBCT or a CT image from the MR image using GAN networks actually. So from these GAN networks, if you have an MRI image, you can convert it to CBCT imaging. Now think about this. If you convert precisely an MRI image to a CBCT image, so why do I need an CBCT machine? Why do I need a radiation? This is gonna be the feature as well, and it will be quite interesting to work on this, which we are working heavily. So maybe 5 years later, we will be talking about different kind of like dental MRI machines that can be generated with regular CBCT images without any kind of radiation. So maybe 5 or 10 years later, of course, right now CBCT is very standard for dental use, but perhaps MRI may replace CBCT in the future as well.
By the way, Professor Kaan Orhan, we have a comment on the checkbox. I read it if you don't mind. It is from Dr. Cansu Büyük. It says, thank you for the excellent presentation and for generously sharing your insight, Professor. Given the strong performance of AI-based image analysis in dental and maxillofacial imaging, together with the rapid advance in large language models, how do you foresee the short and long-term transformation of DMFR and healthcare practice? Thank you.
The large language models are also the feature that we'll be using pretty much. So actually in CranioCatch, we also created a large language model. So when you feed it, when you upload a 2D or 3D image model, a LLM will help you to understand the image, and step by step, it will define you the anatomy, it will define the pathologies as well. So pretty much these large language models is on the way. So we will be using just like a regular ChatGPT or just like a Gemini. As all of you know that in the Gemini, they created a quite nice algorithm to detect on CBCT as well. So you can also make the anatomical landmark segmentations, and you can talk with the large language model, with the Gemini, to understand the chest CTs as well. We also created something more similar like this. So when you uploaded a 2D or 3D images, step by step, the LLM model will tell you about the anatomical landmark and the pathologies as well. And also it can generate you the reports as well. So, but the question is how it's going to be affected, especially for the dentistry, especially for the GP, general practitioners, that it will be very, very helpful. Because the dental practitioners are not, or they are not experienced, or they are not using like heavily these, like especially 3D imaging modalities. But right now, if they have these types of decision support system together with the LLM, especially large language models, it is gonna be also a game changer for them. And not just only for the diagnosis and for the treatment as well. So out there, as all of you know, that not just on the ChatGPT, Gemini, Cloud, and Persepolis, they release their open source as well. So pretty much, you can easily generate a large language model for the maxillofacial or dental use as well, using these types of open source, even right now. But the issue is that the algorithms should be work all together with these large language models. But as I mentioned, it will also do the reshape of the dental clinic in the very future. So you can speak with this large language model. Now think about this: when you come to your dental clinic or when you scan a patient, you can just like tell the large language model, hey, let's say CranioCatch, what is that? What you can see, and it will step by step tell you, like in this is a 2D panoramic image, you can see this and that, and this can be this and that. Of course, you are not just going to rely all the things that the large language models are telling to you, but this is a decision support system can be used for the GPs as well.
Okay, thank you, Professor. And we have another question. It is from Gözde Haksayar. I would like to thank as well and ask a question about managing OPMD lesions. Do you believe AI will play a major role in early detection and prediction of OPMD lesions in the near future? Best regards.
This is a high possibility to do so. One main problem in the dental AI world is actually the lack of the data, the lack of the open source data. So pretty much there are like a couple of sites that can provide these like 3D tooth fair and so on. They can provide like open source, but the main problem is we don't have too many data. But there is a term which is called like federated learning. If we consider federated learning, so this means that everybody is just contribute all the data for this federated learning from different kind of clinics, from different kind of like regions, from different kind of countries and so on. Then the algorithms will learn faster and faster. So if we have this amount of data, then the lesions that we are talking about will be much more efficiently and quickly be diagnosed. But in this way or in that way, we're just going to achieve in the very near future. So it will be coming actually.
Thank you. Thank you for answering, Professor. So I'm constantly checking the question and answer box. Right now, I guess we don't have any question. So we can go to end of this webinar if you don't have any question.
Once again, thank you very much for having me. I will be very happy to reply any kind of question that will be coming from the audiences later on. So feel free to contact with me, and hopefully I will be seeing you all around the world.
Thank you for attending this webinar, Professor Kaan Orhan, and it was a pleasure to see you here. And thanks for your sharing your insight to us. Thanks again.
Thank you very much. Bye-bye for now.